begin with, I'll first talk about what cholera is and what others have done in the field of cholera to end its transmission. So cholera is an infectious disease that once that it's left untreated, it can even lead to death or loss of life. So worldwide, it is estimated that 1.3 to 4 million people around the world get cholera, and 21,000 to 143,000 people die from it. So that being said, mapping of cholera cases have helped to understand the patterns of transmission and also how best we can disrupt those transmission. So I've also been inspired by the works of John Snow. I don't know if most of you have heard of who John Snow is, but John Snow has helped to map and also to end cholera in the district of Soho in London. So what John Snow did, he took a printed piece of map, and he was mapping each and every point where he heard that most people are dying of cholera. So by the end of the day, it was observed that those deaths were coming from where the water pump is, such that once the water pump was closed, and that was the end of cholera in Soho district in London. So that being said, mapping has been a detrimental tool in tracing the hotspots of cholera and also to end the transmission. So cholera has not spared Africa, and more especially Malawi, where challenges in provision of water and good sanitation still exist. And cholera has been a recurring problem up to date. So Malawi has experienced the largest outbreak between 2001 to 2002, and it has affected 26 of the 29 districts, with 33,546 cases and 968 deaths, with a case fatality rate of 3%. So currently, there's another outbreak with cases being reported since March 2022. And as of 7 August 2023, the outbreak has actually infected almost 58,981 worldwide, causing the death of 1,768 cases. So initially, the outbreak, which was only localized to only 26 districts, has now spread to all the districts in Malawi. And Blantyre registered 8,932 cases with 227 deaths. So then why do I want to develop a dashboard? So in Malawi, it has been observed that public health systems are unprepared in terms of resources. So there's a need for customized tools such as dashboards to visualize the disease burden, to help mobilize the right resources, and also inform early warning systems. So most cholera cases in Malawi, for example, are not hosted on interoperable systems for effective communication. And most of the communication that we see with regards to cholera has been conveyed through PDF format. As you can see, the diagram just to my right, we only see that there are 28,981 cases and 1,768 cases, but we don't actually know like where those cases are coming from, like which residential area those cases are coming from. So I find that kind of reporting systems not very interactive in reporting cholera cases. And as such, it has an obstacle to better understand and also to overcome the devastating effects of cholera. So in my study, like I said before, I want to develop an interactive dashboard to visualize how cholera hotspots are in Blantyre district, Malawi. So in order for me to do that, I need to obtain cholera case data of Blantyre district, and also to collect geospatial data of residential areas around Blantyre. Since I want to do this this dashboard at the residential area level, so I thought it's essential that that area data has to be collected as well. and also to provide real-time surveillance data to guide targeted public health interventions. So in order to address the objectives, there's need to collect cholera case data, which in this case, with the collaboration with the Blantyre DHO, I was able to get that cholera. Just to give you a picture of what the cholera cases, the spreadsheet that we collected look like. So we had a column of villages where it listed where people are coming from, the health facility, where those people were reporting to, and others like maybe the case status of people, whether they were confirmed of cholera, or if they went to the lab, if they are positive or negative. So we had that kind of data that helped us to facilitate in the development of dashboard. So in our initial step to obtain the location of where those people are coming from, we collaborated with the National Statistics Office, where they shared us coordinates of where people are coming from. But then we found that most villages of which people recorded they are coming from, such kind of data was missing in the NS spreadsheet. So with that being observed, we conducted a fieldwork activity in order for us to collect the missing data and also to add on the missing villages for future use as well. So for a start, we developed a survey in Kobo to geolocate those villages. So we developed a simple survey where a field collector could record the village and also took a coordinate. So with embedded maps in Kobo, it was easier for us to track where those locations were collected and also for validation in case maybe something went wrong, the coordinate could be recollected. So we also involved the villagers. So this kind of approach of collecting data was some sort of participatory mapping. So we involved motorcycle operators who helped us to move from one village to another to collect the coordinate. And that is shown by the picture A. And B there, we had a youth mapper who helped us like to collect the data. So that youth mapper was trying to cross a river to reach one of the hardest reach areas in Blantyre. So we also involved health surveillance assistance from different hospitals, health facilities to help us to actually locate the locations of villages. So by the end of the day, actually, we were able also to sit down in one of our offices in Malawi at Malawi River Welcome program to validate our data that we collected in Kobo to check for maybe if there are any anomalies and everything. So that's also shown by the picture see there. So our final data set was then developed in African Geoportal. So African Geoportal is actually an online source platform which allow our users or service providers to visualize their data and share to the communities. That's free of charge. So the outcome now of the villages that we collected was that a total of 908 residential areas were geolocated. So that was all done in Kobo Toolbox, which is also an online software. So that's just giving you a picture of what the kind of data that we collected. We had a column of village and also the geopoint of those villages. So we did our data cleaning in R, and then it was exported now and imported in QGIS for visualization. So the map you are seeing there is actually trying to show us the study area, of our study. So you can actually see the map of Malawi there, where Blantyre is placed, and the villages that we collected were also distributed in space, as you can see in the map there. So again, in R, we combined those geopoints we collected the village and then combined them to the overall now of the data set of cholera. So it's like now we had a spreadsheet with the villages, the cases, and also the geopoint. So now this was then the cases were then calculated in proportions, and this was now imported in our portal for dashboard development in African Geoport. So this kind of visualization, it was easier for us to know, like, where most cases are coming from and which villages those cases are coming from. So with this kind of visualization, it's easier for policymakers or researchers to know where they should put more effort for cholera interventions and also for decision making. So in addition to that, this kind of visualization, it enables us also to know, like, which health facilities in Malawi had most cases of cholera being recorded as compared to others, and how many cholera cases have been recorded so far, or how many females or males, or which months of the year has most cases as compared to others. So overall, the dashboard has been a detrimental tool for mapping and also to trace where cases are coming from for easier interventions of cholera. So then what can we get from this development of a dashboard? So open mapping has proven to be a support tool for understanding the epidemiological patterns associated with cholera. And its implication has been that it has enhanced the visualization of the spread of cholera and highlights areas at risk. Rather than that being said, we also observed that there's no standardization with regard to recording of patients' home. As you observed that, as we are trying to geolocate the villages, we found that what the NSO in Malawi recorded and what people recorded in hospital records, there was kind of a mismatch. So this has been a challenge limit for scaling up our dashboard. And again, participatory mapping has enhanced the ownership of the collected data. Since people are involved, health facilities were involved, so it's easier for the villagers to welcome the development since they're involved in the development of this dashboard. So for the sustainability of this work, so the underlying data set of the residential area is to be deposited in master. So master again is a Malawi spatial development. It's a platform. It's a free of charge. Don't have to pay anything. You can access data free of charge. So instead of other researchers trying to redo the study, they can actually access this kind of data sets free of charge. Yeah. So again, the development of the dashboard is in the process of being handed over to the Blantyre district health office so that they can manage it, and also for them to easily track where the cases are coming from. Yeah. So actually, I'd like to acknowledge the foreign organizations and people for their contributions to make this study a success. Thank you. I don't know if there are any questions. I can take questions now, if there are any.
Thank you for the presentation. So we have a question.
Hello, come again?